The Labour leader, Sir Keir Starmer, says he'll introduce new NHS targets on cutting deaths in England from heart disease, strokes and suicide if his party wins the next general election. In a speech in Essex, he said the NHS is not sustainable without serious, deep, long-term changes. Our political correspondent Helen Catt reports.
At an ambulance station in Braintree, with the crews watching on, the Labour leader chose to sound an alarm.
At the next election, the NHS is on the line.
It's not exactly the first time that Labour suggested the NHS would be at stake in an election. But earlier this year, the waiting list for hospital treatment in England hit a record high. Sir Keir pledged to meet targets that have been missed for years.
A&E back to the 4-hour target. No backsliding, no excuses. We will meet these standards again. We will get the NHS back on its feet.
There were new targets too for treating the biggest killers.
Heart attacks and strokes. We'll get them down by a quarter within a decade. 2, cancer. We will make sure 75% of all cancer is diagnosed at stage 1 or 2.
As for the how, Labour suggesting a greater shift towards technology.
OK, can you stand with your chest?
In Huddersfield Royal Infirmary, for example, artificial intelligence is being used to check X-rays for signs of lung cancer.
There is a real variance in regions around lung cancer diagnosis. So you could be in Huddersfield or you could be in Harrow. You're going to get the same speed in terms of diagnosis, but also the same accuracy. And I think that's a really fantastic outcome.
Labour also wants to shift care out of hospitals and into the community and put a greater focus on keeping people healthy.
Well, we don't need a fancy speech from Keir Starmer to find out what Labour would do with our National Health Service. They've already run the National Health Service in Wales, where they have an appalling record.
When it comes to paying for the plans, Labour hasn't yet put a figure on it.
Would you expect under Labour that overall more money would be going into the NHS?
Money is important, but it's not all about money. Change and reform plays a hugely important part. Technology can do what money can't do.
Money has been an issue, though, when it comes to staff pay, and there wasn't any detail to address that today. Keir Starmer's targets are meant to get people talking. His job over the next year or so will be to convince voters Labour can deliver them. Helen Catt, BBC News, Braintree.